Welcome to Radi Us, our University of Manitoba Radi Faculty of Health Sciences monthly podcast, where you get to catch up on the headlines from the past month and meet our faculty, staff, and learners making news. We'll also be engaging with our Radi community beyond our campuses, so be sure to listen for alumni and partner voices too. The Roundup for the month of February 2026 includes stories about Black History Month events, including the Black Health Symposium, new funding for mental health research projects, and 5 Radi faculty members make the CBC Future 40 list, and more. I'm Jonathan Wilson from the Radi Faculty Communications and Marketing team. Over 100 nursing students, faculty, staff, and invited guests gathered in the atrium of the UM's Helen Glass Center for Nursing on February 2nd for a lively, colorful, and inspiring Black History Month celebration. The 2-hour event featured greetings from Black nursing leaders, alumni, and officials, and showcased the talents of several Black College of Nursing students through poetry, dance, visual art, modeling, and music. With the theme, From Barriers to Breakthroughs, Black Nurses Inspiring Change, this was the second annual Black History Month event at the college. It was co-hosted by the College of Nursing and the Manitoba chapter of the Canadian Black Nurses Alliance, a student-led initiative that was founded by instructor Shakira Jones-Hall in 2024. Halima Casimo, the college's CBNA vice president, was one of 6 student dancers who performed. She said the event was a great way to celebrate the efforts Black individuals have made toward culture and healthcare.
So we just wanted to take a chance to celebrate it, have fun, not think about classes too much, celebrate our culture, eat our food, do our dances, wear our cultural wear, to feel good, because there are a lot of Black students in the College of Nursing. And it's just sad knowing that 60 years ago, the Black students that were in the College of Nursing didn't have this opportunity. So I think it was good for us to just come together and celebrate and showcase our talents, because even though we're in nursing, we have some good dancers, we have some good singers, we have some good artists. And it's also a reminder that, nursing doesn't have to be everything. There's hobbies outside of that. And so it was really important for us to come together and do this today.
The Black Medical Students Association held its 3rd annual Black Health Symposium at the beginning of February. More than 60 high school students and undergraduate learners registered for the full-day event. The students participated in workshops and a panel discussion on navigating the early years of medicine. The symposium also included keynote speeches by Minister of Health, Seniors, and Long-Term Care Uzoma Asagwara and Dr. Andrew Ajushubutu, a neurosurgery resident and Max Rady College of Medicine class of 2019 valedictorian. For Alim Daniel, a grade 12 student at Grant Park High School, the 2 keynote speeches resonated with her.
What I took away from the speakers is that, regardless of, how difficult it is or anything, you should do it if you enjoy it. That was something that was very emphasized today, is if you enjoy it, then you should pursue it.
Patricia Charity Machikara, a second-year medical student and the Black Medical Students Association's co-senior executive, said it's important for Black medical students to help increase representation, and that's one reason the group hosts the symposium.
I think it's a great event for pre-meds to come and network with current medical students, with other allied healthcare professionals, so that they can see what their future can possibly be and that their aspirations are actually attainable.
An innovative led project will train people with lived experiences from across the prairies to work with researchers on developing clinical trials focused on HIV and sexually transmitted and blood-borne infections. Study leader Dr. Yoav Keenan, a professor of internal medicine and medical microbiology and infectious diseases at the Max Rady College of Medicine, said training people with lived experiences will help the research team to formulate questions about patients' needs. Keenan said people with lived experience could include those with HIV, experiencing homelessness, or struggling with injection drug use.
We believe that this type of participatory research is needed to make sure that the questions asked and the answers received are meeting the needs of the community. So most of the clinical trials training platforms are for professionals, for researchers and clinicians and clinical trialists. This will be a unique attempt to cluster together with people with lived and living experience.
The project recently received a 4-year grant of $800,000 from the Canadian Institutes of Health Research.
Having this funding allows us to plan and to work together with Saskatchewan and Alberta to enhance the capacity of the prairies to determine what clinical trials are important for us and which ones are our priorities.
The funding will help train more than 12 people from across the prairie provinces. When Manitoba cut public funding for lactation consultants in 2018, health experts at the Rady faculty warned the impact would be immediate and far-reaching. Research led by Dr. Gary Shen, a professor of endocrinology and metabolism in the Max Rady College of Medicine, and an expert in diabetes in pregnancy, shows just how significant the effects were. In 2022, Shen's team studied the effects of the program's cancellation. They compared infant feeding data from the Women's Hospital at the Health Science Centre, where lactation consultant services were cut, to St. Boniface Hospital, which kept its program through alternative funding. Shen said the results were clear. Breastfeeding rates dropped and formula use increased when the lactation consultants program was cut.
We already know from the previous study in the province, this program, if stopped, could cause how much damage in women and children, particularly in First Nation.
Shen's findings helped inform Manitoba's decision to reinstate the program on a 2-year probation in 2024, and in October 2025, the province announced it would be made permanent. 5 faculty members from the Rady Faculty of Health Sciences were named to CBC Manitoba's Future 40 list, an annual showcase of bright young minds and influential changemakers under the age of 40. In total, 8 winners were selected by a panel based on nominations from the community. Those from the Rady faculty included Shakira Jones-Hall from the College of Nursing, Ivan Lurchenko from the College of Pharmacy, Dr. Renee El Gabalawe, Dr. David Perrin, and Dr. Robert Beatty from the Max Rady College of Medicine. Beatty, an assistant professor of biochemistry and board member with the Manitoba Neuroscience Network, said he was humbled by the recognition. He was noted for his research, which looks to understand the progression of neurological disorders such as autism or schizophrenia.
We take a unique approach here in Manitoba where we create genetic mosaic models of different neurological disorders, and we can then track how those genetic changes in the same tissue affect the development of neural stem cells. And so we track those neural stem cells over time, and we label them with different fluorescent markers, and we can identify how specific or how unique genetic changes can result in lineage changes or changes in the cells and what they become and how they function.
The College of Community and Global Health, or CCGH, officially launched on January 26th at an event on the Bannatyne campus. As the 6th college in the Rady Faculty of Health Sciences, it brings a uniquely interdisciplinary approach. Under one academic home, CCGH brings together medical doctors, nurses, Indigenous health scholars, economists, sociologists, anthropologists, statisticians, computer scientists, and many others, all working collaboratively. At the launch event, Dr. José Lavoie, the inaugural dean of CCGH, addressed the crowd.
At CCGH, we regroup outstanding scholars and practitioners, skilled learners, and dedicated staff members committed to system transformation to improve equity, social justice, reconciliation, and Indigenous rights through the teachings that we do in our classroom and the research that we do with communities. We're rooted in community, but we are connected globally. And those two pillars, the local and the global, are in dialogue with each other to try to bring lessons from elsewhere to communities, to explore how they might actually support community aspiration towards better health.
6 community organizations are receiving grants to support innovative mental health projects, thanks to new donations to an interdisciplinary initiative at the Children's Hospital Research Institute of Manitoba, co-led by 2 researchers affiliated with the institute. PRIME, or Partnering for Research Innovation in Mental Health, is a research theme founded in 2022 by Dr. Mandy Archibald, Associate Professor at the College of Nursing, and Dr. Leslie Ruse, Associate Professor of Psychology at the Faculty of Arts. RBC is supporting Prime X community grants with a $250,000 gift. Additional funding comes from Sobeys Family of Support, which is the main funder of Prime, with $150,000 annually. One of the projects funded is a youth-led Indigenous mental health initiative with the Canadian Mental Health Association Manitoba and Winnipeg that Archibald will be working closely with on an arts-based and qualitative research project. Laurie McPherson, Director of Research, Evaluation and Innovation at CMHA Manitoba and Winnipeg, said the My Path Forward initiative is inspired by Indigenous youth who expressed their interest in a recent Manitoba Advocate for Children and Youth report.
This is from what youth in Manitoba said, so that really struck me that, this is something that youth are saying they need and want and benefit from and would like to be a part of. So, so that was what kind of inspired me for us to think about how we could create something. And this grant, of course, gives us the resources to be able to do that. And really appreciative of the collaboration with the university, having the expertise around research and program development, and just that'll be amazing.
The National Collaboration Centre for Infectious Diseases is celebrating its 10th anniversary of being housed at the University of Manitoba. NCCID is the go-to source for Canadian public health professionals seeking the latest information on infectious diseases. The centre is led by Dr. Yoav Keenan, a professor of internal medicine at the Max Rady College of Medicine. Margaret Hallworth-Brockman, NCCID's senior program manager, said a great example of the critical service it provides was during the COVID-19 pandemic.
So it was pretty exciting. It was very intense.
When news of a brand new coronavirus was spreading around the world in January 2020, the NCCID jumped into action and quickly created a disease debrief that summarized what was known about the virus. As the pandemic continued, NCCID produced webinars, podcasts, and provided public health professionals with information online.
By October of 2020, as the first vaccines were already coming online, the Public Health Agency of Canada said, we're going to need help from NCCID to push out the information on what the vaccine makeup is, how they're going to be used, who's eligible, how they'll be distributed, and so on. So altogether, I think we did 28 webinars with the federal government over the following 14 months, half in French, half in English, doing exactly that.
As well as informing public health practitioners, NCCID is also dedicated to training the next generation of public health leaders. February was Psychology Month, so we are highlighting the important research that Dr. Kylie Clayton is conducting on feeding disorders. Clayton is an assistant professor of clinical health psychology at the Max Rady College of Medicine. Some of the kids she works with are more than picky eaters. They have feeding disorders. The serious condition can include the refusal to eat certain foods because of anxiety or fear of eating, sensory processing differences, lack of appetite, or interest in eating. In a recent study, Clayton looked at 8 years of data to understand who was presenting with feeding disorder symptoms at Shared Health's Clinical Health Psychology Child and Adolescent Consultation Service. She found that it is a complex problem.
Often there's concerns kind of in multiple areas with the feeding difficulties. So it's not just anxiety or just like sensory based. Often it's evolved to be multiple of those concerns happening at the same time. Oftentimes families have been really struggling with these concerns for a long time before they come to us.
While the bulk of feeding disorder research is coming out of the United States, Clayton is studying the growing field from a Canadian perspective.
I know in some of the areas I work in, a lot of the research is coming out of the States, which is a very different healthcare system and different needs. And so I think going forward, that's really going to be a focus for me in looking at different levels of intervention as well. So how can we provide supports when families are on the wait list, as well as meeting the needs of families at different points in time to give them the care that they need.
Thanks for joining us today. Radius is heard monthly on UMFM 101.5, and all episodes are available for stream on Spotify, Apple Podcasts, and YouTube. Please send us any ideas and feedback to radiomarketing@umanitoba.ca. Read more about this episode's stories by reading the show notes or visiting our new UM Today news site at umtoday.ca.